Hello, and a very warm welcome to all of you joining us from around the world to launch the State of the World's Children Companion Reports, Feeding My Child, Food and Me. My name's Amanda Third, and I'm co-director of the Young and Resilient Research Centre, who partnered with UNICEF's State of the World's Children team and 18 UNICEF country offices and national committees internationally to undertake the study that forms the basis of these reports. As is tradition in Australia, we'll begin the proceedings with a welcome to country.
My name's Matilda Harry.
And I'm Luke Hodge, and we are both proud Aboriginal staff and students here at Western Sydney University. Together, we would like to acknowledge the sovereign custodians upon the lands of which our campuses stand.
We acknowledge the elders, past, present and emerging, of the Darug, Eora, Dharawal and Wiradjuri nations, and we would like to thank them all for allowing us to continue our business and education on their lands. Western Sydney University is committed to Indigenous excellence and knowledges, as we aim to promote a strong network of Aboriginal and Torres Strait Islander staff, students, alumni, researchers and elders. We would also further like to extend our respects to any Aboriginal and Torres Strait Islander prospective students and guests with us today.
Thank you for joining us for the launch of the two reports addressing the important and urgent issue of adolescent and maternal nutrition. The two reports are entitled Food and Me, How Adolescents Experience Nutrition Across the World, and Feeding My Child, How Mothers Experience Nutrition Across the World. These reports are based on participatory research with adolescents and mothers in 18 countries around the world. The insights from these consultations were included in UNICEF's flagship 2019 State of the World's Children report, and now these two reports undertake an in-depth exploration of adolescents and mothers' experiences of these important issues. We're very pleased today to be joined by a range of esteemed guests for the launch of these reports, and in particular I'd like to welcome UNICEF Executive Director Henrietta Fore, UNICEF Australia CEO Mr. Tony Stewart, Chancellor of Western Sydney University Professor Peter Shergold, Global Director of Nutrition at UNICEF in New York Dr. Victor Aguayo, Senior Advisor to USAID Nutrition Ms. Peggy Cones-Buher, and Yale School of Public Health Professor Rafael Perez Escamilla. And we also have a range of other esteemed speakers and panelists, and it's an honour to have you all in attendance. Thank you. UNICEF and Western Sydney University are grateful for the support of the governments of the Netherlands and Norway in realising this research. And we're equally grateful to all of our audience members joining us from around the world today. In a moment, I'm going to hand over to Mr. Tony Stewart to welcome you and talk you through the national and regional context for these reports. Then Executive Director Fore will speak to the international context of these reports before handing over to Chancellor Shergold to formally launch the reports. Following that, Dr. Catherine Fleming and Professor Virginia Schmid will walk us through some of the key findings of these two internationally comparative reports that centre adolescents and mothers' insights and experiences. And then we're very excited to have young nutrition advocate Ms. Florence Sibarama to reflect on the findings, following which we'll open up to Q&A with key experts in the field. Audience members are going to have the chance to pose questions to our panel, and you can do so by entering your questions using the Q&A button on the bottom right of your control panel. Please know that we will be recording this session so that it can be shared with our many partners who weren't able to join us today due to time zone differences. Our event hashtag is Children Eating Well, and you should feel free to tweet about the event. So without further ado, it gives me great pleasure to introduce Mr. Tony Stewart. Tony is the CEO of UNICEF Australia. As you'll know, UNICEF is the world's leading organisation working with governments for vulnerable children. UNICEF advocates on behalf of and delivers programs for children domestically and internationally. Tony serves as the chair of the Australian Charities and Not-for-Profits Commission Advisory Board, is a member of the Australian Prime Minister's Community Business Partnership, and recently chaired the Not-for-Profit Advisory Board to the National COVID Commission. Tony, welcome, and over to you.
Thank you so much, Professor Third. It's a privilege to be here today. I would also like to acknowledge the traditional owners of the land here in Piedmont, where I am calling you, being the Gadigal people of the Eora Nation. And today, as we look at the important research on child and maternal nutrition, it's really important to remember that many of the disparities that we will talk about today disproportionately impact Aboriginal and Torres Islander communities in Australia. These disparities, while global in nature, are so relevant in our context, and I think this report could not come at a better time for what we're seeing in parts of Australia. I'd also like to take the opportunity to congratulate Chancellor Peter Shergold and yourself and all of your colleagues at Western Sydney University, my favourite university. You just keep punching above your weight in this city because this is such an important couple of companion reports. It's also important that the perspectives of young mothers and young people are heard. And I think they will help us with the challenges of feeding children and eating well. And I'm just humbled to be a very small part of a wonderful cog in UNICEF, but to see our colleagues across the world and then to see partners and to hear about nutritional ambassadors such as Florence, Rwanda. It's been a long time since I've been there, but it's just fantastic to see everyone here. I would like to point out that as ED4's presence today demonstrates, UNICEF is really committed in this space. We are a world leader in research and evidence in all aspects of children's health and well-being. I'm delighted to finally meet Brian a few minutes ago because the State of the World's Children's Report is our flagship global publication. And it's used by governments, researchers, and practitioners. It certainly helps us here in UNICEF Australia with our conversations with industry and government. In 2019, the State of the World's Children's Report, the focus was on nutrition. And as you're probably all aware, that report highlighted that at least 1 in 3 children under 5 are undernutritious or overweight, and 1 in 2 are suffering from hidden hunger. That by improving children's nutrition is going to require food systems to deliver nutritious, safe, affordable, and sustainable diets for all children. Having had the opportunity to read the new companion reports, I was really struck by the fact that most children between 6 and 23 months do not consume at least 1 serving of fruit, vegetables, or starch vegetables or plant or proteins during an average day. I was also really shocked to see, and I guess it's no surprise, that 1/3 of the diets of adolescents contained ultra-processed food and drink. This is something that my daughter and I were in the Philippines volunteering just before I joined UNICEF. And at a school, she was horrified to see so much beautiful fresh food around, and yet so many school lunch boxes complete with canned fruit and processed food, something which is exactly what's happening in so many parts of Australia. And so in a high-income country like Australia, our initial thought might be that the most challenges that children from accessing nutritious diets have already been addressed. After all, it's 2020. Sadly, this is not the reality. Children and families in Australia are facing challenges at both ends of the nutrition spectrum. At one end, we know that 1 in 6 children in Australia are living below the poverty line, according to ACOS. And we know for these families, just being able to afford the basics of a good diet is not always possible. Just as with many families, access to fresh foods is not possible, as we're seeing more and more convenience stores with processed foods nearby and less stores with fresh foods. Sadly, at the other end of the spectrum, here in Australia, childhood obesity is a worsening challenge. And as somebody who's a dual citizen, with New Zealand, that's a major topic across the Tasman as well. Here are 2 countries very close together, both dealing with really big issues on obesity per capita. We know now that the Australian Institute of Health and Welfare is reporting 1 in 4 children is overweight or obese. So in Australia, we're going to really want to work together, and it's so good for us to have partnerships with the universities and with the sector, because we've been pushing, whether that be stopping the promotion of junk food during children's hours on TV, food labeling. There's so much more we can do, because good nutrition is the basis of healthy development. One of the things I'm so excited about today is just the collaboration that we've been able to achieve. We know good nutrition is a critical foundation for the development of children. And at UNICEF Australia, we're committed, even though we would like to think we shouldn't have to in a high-income country, to really being part of this campaign to drive change. I'm also pleased to announce that UNICEF Australia and Victoria Health have just announced a new partnership where we will be joining forces to push for better support for children and children's rights in Victoria, and nutrition will be one of the key elements, something we wish to do with other states. But unfortunately, even in countries as fortunate as Australia, these challenges are just so very, very real. Just to put it back in the Australian context, and I know you'll hear about the global context in a minute, 1 in 5 Australian children are commencing school with a development vulnerability. Disadvantage is complex and has many contributing factors. However, we do know for certain that many children do not have their nutritional needs fully met. That's why, for example, in the Northern Territory, UNICEF Australia is partnering with an Indigenous community-led initiative called Indie Kindy, which aims to improve the outcomes of Indigenous children under 5 in the areas of health, nutrition, and early learning. So the challenges to children's wellbeing revealed in the World Children's Report underscores the importance of us all stepping up, not just across countries who we would normally expect this to be an issue in, but also in high-income countries. This is a global issue. And it's really wonderful acknowledgement that ED4 is here today. I would like to thank her personally for her leadership of UNICEF to ensure that we're there for children everywhere in the world, including countries like our own. And congratulations again, Amanda and Chancellor Shergold and your teams for this brilliant piece of research. Thank you so much.
Thank you, Tony. That's very kind of you. And I think, just picking up on your point about lunchboxes, I did make a special effort to make sure my son's lunchbox had 5 food groups in it this morning. But it is an ongoing challenge for sure. It's now my great honour to introduce Executive Director of UNICEF, Ms. Henrietta Fore. Henrietta Fore became UNICEF's 7th Executive Director on the 1st of January 2018. She's worked to champion economic development, education, health, humanitarian assistance, and disaster relief in a public service, private sector, and non-profit leadership career that spans more than 4 decades. ED4, the floor is yours.
Thank you very much, Amanda, and thank you very much for a welcome. To hear a didgeridoo and the students was a real delight for all of us. So thank you. It made us feel we were in Australia for a moment. So good morning and good evening, everyone. On behalf of UNICEF, it is a real pleasure to join all of you for this important event. Nutrition has long been at the core of UNICEF's work, and that's because nutrition is at the core of every child's health and well-being, as you know, Amanda, from your morning lunchbox for your offspring. Last year, our flagship publication, our State of the World's Children report, did indeed cast a spotlight on children, on food and nutrition. So I will repeat some of the statistics that you have heard from Tony, but that is because you are now to memorize them. Whether you're eating breakfast, lunch, or dinner next, you are to share these statistics with a friend. So here we go. The report highlighted that at least 1 in 3 children under 5 are undernourished or overweight, and that 2 in 3 children are not fed the minimum diet they need to grow, develop, and learn to their full potential. We are very concerned that the COVID-19 pandemic may have exacerbated this situation, and around the world, tens of millions of families are being hit hard by the economic fallout. We estimate that an additional 140 million children will fall into poverty, further threatening their access to nutritious and safe diets and disrupting essential nutrition services. And this is because of COVID-19. So today I would like to emphasize the experience of young mothers and young people as they interact with our food system. What choices do they have? What choices do they make? And if the availability of healthy foods is limited, what choices can they make? What are the time and money pressures they face in feeding children well? And how do they respond to the relentless pressure of marketing of unhealthy foods? To help families feed children better and to help young people make better food choices, we need to better understand how they perceive and respond to these questions. And today, with the launch of these two follow-up reports to State of the World's Children report, represents an important milestone. These reports help us to identify the perceptions of young mothers and young people on a number of key issues: food and nutrition, barriers to healthy eating, probable solutions for a responsive food system, and much more. These two reports also reveal the findings from workshops in 18 different countries, from Australia to Zimbabwe, where more than 1,200 young mothers and young people sat down to discuss the real day-to-day challenges that they face in feeding their children and in eating well. As Vice Chancellor Glover and I note in our forwards, mothers told us in their own words about everything from the challenge of eating well during pregnancy to the bond developed when a baby during breastfeeding, and the anxiety of coping with fussy eaters. Young people told us about wanting to eat healthily, but not being able to do so because they lacked either time or money to do so. Or in far too many cases, healthy food just wasn't being sold in their schools or in the local shops and markets near their schools. And as we've learned, for some, the challenge was eating it all. At one workshop, a facilitator noted that the young people who were participating in her event, one said, we didn't eat dinner tonight. We won't eat dinner tomorrow night. Some of us just drink milk for dinner. That quote should help us to stop for a moment and to think about what it is like that they are experiencing, what's happening in their lives. Throughout my time as executive director, I've sought to also make UNICEF a leader in providing young people with a place to make their voices heard and play a real role in bringing about change in their communities and in their societies. These workshops provide a vital first step in making that happen. And young people showed us that they want to eat healthily. They also showed us that they believe that change is possible, and they have plenty of good ideas on how to bring about that change. So my question to all of you is, how do we make that happen collectively? How can we support young people and families to be agents of change in ensuring that every child and every young person has access to nutritious, safe, affordable, and sustainable diets? Since the reports provide the community's perspectives, I hope they will be a useful tool for practitioners and policymakers in developing policies and programs. We urge governments and partners alike to ensure that every child, young person, and woman has a nutritious, safe, affordable, and sustainable diet that they need for every moment in life to reach their full potential. On a final note, I join with Tony and I thank my colleagues at UNICEF headquarters, country offices, and national committees in all 18 countries over the world for making this project happen. I want to applaud the wonderful work of Amanda's team at Western Sydney University, which led to the design and analysis of the focus groups. And I want to thank Peggy and Raphael for their invaluable wisdom and advice throughout this project. I want to thank and acknowledge the support of the governments of the Netherlands and Norway for partnering with us. And most importantly, I'd like to express my gratitude towards the young mothers and the young people who agreed to talk to us and shared their candid insights and suggestions. Without all of you, this endeavor would not have been possible. So on behalf of everyone at UNICEF, thank you all.
thank you, Edie, for well, thank you not just for your words just now, but in general for your leadership on these issues. And I think you know, what I love is your strong call to action on these issues of child and maternal diet and nutrition. And I'm quite convinced that with this kind of evidence, we can begin to make the kinds of changes that are needed. So thank you for your support. It's a great pleasure now to introduce Professor Peter Shergold, who is Chancellor of Western Sydney University. And Professor Shergold will formally launch the reports. Professor Shergold from 2011 to 2019 chaired the New South Wales Public Service Commission Advisory Board. He now chairs the New South Wales Education Standards Authority and is New South Wales Coordinator General for Settlement. He chairs a number of not-for-profit and for-purpose boards and is on the board of UNHCR. He's recently completed government reports on reform of senior secondary education and refugee integration. Welcome, Chancellor Shergold, and over to you.
Well, thank you so much. I am delighted to join you. And for our overseas visitors, you may wonder why so appropriately we recognise country in starting. It's to recognise the fact that 1 billion, let me repeat that, 1 billion Aboriginal Australians walked this land before newcomers arrived from 1788. 1 billion is a large number, and it gives you that sense of deep time, because what 1 billion people means is that Aboriginal people have lived here, we know archaeologically, for at least 65 to 80,000 years. That's 3,000 generations. Now, as Chancellor, I am someone who finds intellectual sustenance in the quotes that are attributed to those great modern philosophers, namely sports stars. In a challenging and sometimes traumatic year that's been marked in Australia by searing bushfire and raging floods, and of course, the social distancing of global pandemic, I bought myself a couple of months ago a T-shirt bearing a quote from the sometimes ethically challenged American boxer Mike Tyson. It says, "Everyone has a plan until they get punched in the mouth." And that, I suspect, has been the experience of many of us as we look back on 2020. But I do hope Tony is right, and that as a university, we do punch above our weight. My quote today is ascribed to another sports star, the great American baseballer Yogi Berra, namely, "It's déjà vu all over again." So why all over again? Because in fact, for me, this is the second iteration of this increasingly close relationship between Western Sydney University and UNICEF. It was in 2017 that I first became acquainted with the remarkable work being undertaken by Professor Amanda Third and the energetic team from the Young and Resilient Research Centre at the university, working closely with UNICEF. 3 years ago, I found myself inspired by their innovative project on how young people are accessing and using communications technology and how they perceive the online world. And now I'm equally impressed 3 years on by the continuation of that engagement in this important work on the health and the nutrition and the diet of mothers and their children. There are, I think, three main qualities about the action research with public impact that originates from the remarkable team at Western Sydney University, working closely and effectively with UNICEF. First, the importance of collaboration. I hope that Western Sydney University is Australia's leading university in terms of promoting a collaborative learning culture, both across disciplines within the university and, most importantly, in taking pride in our collaborative engagement with other universities in Australia and around the world. And also the diversity of the ways in which we are building partnerships with business and with community organisations and with governments in Australia and overseas. And that collaborative impulse is exemplified by what we are celebrating today, namely the remarkable beneficial partnership with UNICEF. I am delighted within the university at the willingness of the School of Nursing and Midwifery and also the School of Health Sciences to give Professor Virginia Schmid and Dr. Catherine Fleming the time and the resources to work on this project. Interdisciplinary approaches are crucial, I think, to behavioural research. But I'm even more pleased at how a mutually beneficial collaboration has been built and has been maintained and has been deepened between the university and UNICEF. In a real sense, it's symbolic of the relationship between Western Sydney and the world. And I think in particular, a relationship between the remarkable multicultural experiment that provides the vibrancy and the energy of migrant Western Sydney and the diverse worlds from which those migrants and refugees had come to build new lives in this strange land. Because migrants, as these studies show, are often facing additional challenges as communities in diaspora, challenges related to their need to adapt to new food ingredients, their difficulty in accessing traditional ingredients, the breakdown of communal and family eating experience, and of course, the intensity of intergenerational change on migrant families. So collaboration, number one. And number two, the continued significance of qualitative research. These two reports show that qualitative research can be crucial in capturing the authentic life experience of people, in understanding how and when and why they make decisions. And at the heart of these studies, there is a profound understanding that such research evidence needs to ensure that the participants, that the data that will be collected from them and about them will be used ethically. More importantly, that they, those who are studied, can become active participants in the design of the research, that the approach is inclusive. I love the methodological innovation that underpins this research, the unique data gathering method, the participatory and creative activities that allow participants not just to answer questions, but to explore their own experiences. And third, well, the third thing I love is that university research can be designed to have a beneficial, real-world public impact through deep engagement with purposeful organisations like UNICEF. I admire research that breaks out of the constraints of so much university endeavour and that speaks to itself too often only in the pages of peer-reviewed academic journals. I love university research that is seeking to make a difference, that wants to bring about change. And that's complicated, of course, when you're hoping to nudge publics to behave in more socially positive ways. In this study, for example, one of the findings that stood out to me is the disjunction between the perceived nutritional knowledge and health aspirations of mothers and their adolescent children to eat better, and the stark reality of how so many live their lives in practice, driven by pressures on their time and their finances and lack of community support. Those behavioural insights, I think, are crucial as UNICEF and governments consider how best to influence more positive nutritional outcomes. And those findings are more significant when one considers the often deleterious impact of online influencers, many espousing nutritional views of doubtful provenance, who collectively are increasing the incidence of body dissatisfaction and, in consequence, of eating disorders. So, collaborative impulse, methodological innovation, purposeful impact. Those three qualities lie at the heart of the research in these two studies, about which others will soon talk in more detail. But for me, in conclusion, what I appreciate is that although the studies think global, they are also deeply rooted in what is local, in the ethnic heterogeneity of Western Sydney. What I am thinking about in Parramatta and Fairfield, in Bankstown and Blacktown, in Cabramatta and Liverpool, is just what UNICEF will be thinking about around the world. Namely, how can we create sustainable change in nutritional practice in which publics and communities can become a central part of the solution. So I'm very pleased to participate today to formally launch these two important reports. To return once more to the aphorisms of Yogi Berra, I want to thank everybody for making this day necessary. Thank you.
Thank you, Chancellor Shergold, kindly for launching the reports and for your ongoing support of the partnership between UNICEF and Western Sydney University. I think one of the things to take away is that the enormous collaborative effort that sits behind the production of these reports is indeed a great strength that can carry the work forward. We're now going to show a short video from UNICEF's nutrition team.
Hi, my name is Timmy, and you're watching Stuff Yourself Cares About, and why I also care about it too. Today, we're talking about nutrition, and here to help me is a nutrition expert, Gabby.
Timmy, what are you doing?
I'm making a nutritious smoothie.
A nutritious smoothie? This is just candy. Where'd you get the recipe?
From a reliable source. From the back of my sugar box.
Timmy, you're gonna get sick.
No, I'm not. I'm gonna be an Olympic athlete.
Not if you keep eating like that, you're not.
What do you mean? It says a complete breakfast.
Timmy, it says part of a complete breakfast. So if you only eat this cereal, your body isn't getting what it really needs.
But it tastes good.
I see that I'm gonna need a little help here. Roll tape.
Today's guest is Pita Tafua, who made a splash on the world stage by being the Olympic flag bearer for his native island of Tonga. He competed in Taekwondo, and 2 years later competed in the 2018 Winter Olympics. Pita is also a UNICEF Pacific Ambassador and all-around good guy. Hello, Pita.
He seems nice.
Thanks, buddy.
Pita, welcome to our show.
Thanks for having me.
Are you gonna tell us that we can't have ice cream?
Man, I'm not gonna tell you that you can't have ice cream. But if you want your body to be big and strong, you're gonna have to give it what it needs. First, let's get rid of this. Now here's marshmallows. Let's look at the ingredients.
I can't even pronounce them. Globbity, wobbly, gloobity gloob. What's that?
I have no idea. But what that means is that food is super processed. And what that means is that they've taken most of the good for you stuff out. Okay, now let's read the ingredients for these things.
Ingredients, orange. Hey, I can pronounce that.
Good, now try that one.
Ingredients, broccoli. Hey, this is easy.
I wanna try one.
But you can't read.
Can't read. Yet.
That doesn't matter. Try that one.
Apple?
That's it. So as a very general rule, try to eat different kinds of foods that have fewer ingredients.
What about ice cream? That only has 2 ingredients, ice and cream.
Well, ice cream has more ingredients than that, but you are allowed a little treat once in a while, so long as for the most part, you aren't eating foods that are super processed.
I'll do it!
That's our show, folks. Thanks for watching.
I'm pretty sure ice cream only has 2 ingredients.
Nope.
Hot dog,
Nope.
hot and dog,
Nope. And nope.
corn dog.
Nope.
So now it's time to hear a little more about these 2 reports in detail. As has already been intimated, these studies sought to elicit the insights and experiences of adolescents and mothers of very young children about how, what, why, where, and when children eat. In order to do so, we were very fortunate to have the support of Brian Keeley and Juliano de Oliveira in the State of the World's Children team and the UNICEF nutrition team in New York, alongside an expert advisory panel to coordinate the facilitation by 18 UNICEF country offices and national committees around the world of workshops with adolescents and mothers. The study used a distributed data gathering method that was first developed by the Young and Resilient Research Centre at Western Sydney University in partnership with UNICEF and Harvard, and it's now been used in over 70 countries around the world. This method involves training facilitators in country to run creative and participatory activities that enable participants, in this case mothers and adolescents, to explore their experiences deeply and collaboratively. Activities involve drawing, scenario-based activities, brainstorming, games, collage, and many others. And participants routinely tell us that these methods are not only engaging, but also build their understanding of issues and their enthusiasm for taking action. So without further ado, let's hear what these methods revealed in relation to adolescents and mothers' experiences of diet and nutrition. And to do so, I'd like to first introduce Dr. Catherine Fleming from Western Sydney University. Dr. Fleming is a lecturer in public health in the School of Health Science at Western Sydney and is a stream co-lead for participation and engagement in the Young and Resilient Research Centre. Dr. Fleming has a PhD in paediatric nutrition and dietetics and over 12 years experience in infant and young child feeding research, paediatric food allergy research and childhood obesity research. Welcome, Dr. Fleming.
Thank you, Amanda. Thank you to esteemed guests and for you all joining us today. In 2019, UNICEF country offices in 18 countries conducted 37 workshops with 656 adolescents in rural and urban locations across the globe. These countries were predominantly lower income countries, but also included the US and Australia as higher income countries. A diverse range of adolescents participated, including some highly vulnerable groups such as displaced refugees in Sudan. Here is what they told us about their diet and nutrition. Adolescents said they valued good nutrition and they saw it as an important part of a healthy and prosperous future. However, despite the value they placed on eating well, our findings show that adolescents in the workshops reported eating minimal fruit and vegetables in the previous 24 hours. In fact, 1/3 of what they ate in the 24 hours prior to the workshops consisted of ultra-processed foods, which was largely wrapped candies. Adolescents from a range of countries also reported they didn't have the knowledge or skill to eat healthily, especially shining a light on their lack of cooking and food preparation skills. We know from current literature that eating family meals together is critical for developing healthy eating habits. In a handful of countries, adolescents did eat at least one meal a day with others, although in Australia and neighbouring countries such as Indonesia, adolescents were often not eating with their families at all during the day. It was concerning to hear that 1/3 of all participants in the workshops ate alone throughout the day. It was also interesting to hear that throughout the workshops, participants often spontaneously mention body image, indicating that it features constantly in their daily decision-making around nutritional intake. To further investigate this, we adapted a standardized silhouette testing method for cross-cultural application to ask adolescents about their current body perception and to help address an evidence gap in lower middle income countries about body image. From this activity, we found that 70% of adolescents indicated they wanted to change their current body shape, and this was either to be thinner or larger. Of particular concern is that the young age at which adolescents desired an extremely thin body ideal. We found that 47% of 13-year-old participants and 34% of 14-year-olds indicated they desired a BMI of less than 18, which is considered underweight. When asked directly if they do anything to change their body shape, 86% of adolescents reported engaging in physical activity and 78% actively changing their dietary habits to alter their body shape. This included specific dieting practices such as intermittent fasting, tracking calories, or increasing protein intake. There was a strong theme of families throughout the workshops, and families were reported as the major influence on adolescent food choice. Adolescents reported that parents tended to make the decisions about what families eat and how they ate. They also discussed a range of parental rules and restrictions that shaped food choices with meals within the home. These discussions show that adolescents had limited autonomy over what they ate within the home environment. After families, social media was the most influential on their dietary habits. Then, along with peers, adolescents said that social media encouraged them to make unhealthy food choices outside the home environment. Individual factors such as taste also played a major role in determining adolescent food choice. Adolescents commonly reported preferring the taste of unhealthy foods more than healthy foods, while yet understanding the need for a healthy diet, they expressed a reluctance to eat more fruit and vegetables simply due to the taste. For 60% of adolescents across our sample, financial constraints were the greatest barrier to healthy eating. Also, over 1/3 of adolescents found accessing healthy foods a key barrier. This was especially given the ready availability of unhealthy foods within their communities and environments. For those in rural locations, they found it harder to access animal protein, fresh fruit and vegetables compared to their urban counterparts. Within the school environment, less than half of participating adolescents reported that healthy food options were available, which posed yet another major barrier to healthy eating. Culture and gender also posed a barrier for young women within the study to choose healthy food options. Gendered norms often meant that family eating patterns were dictated by a senior male member. This was also exacerbated by the fact that men were reported to more likely maintain financial control over how food was purchased. So in summary, across the globe, adolescents reported that food systems are failing them and thwarting their ambitions of a healthy future. Adolescents are not getting the nutrition they need. Many regularly skip meals. Some eat the majority of their meals alone. And they reported that both at home and outside the home, healthy food options were hard to find. Affordability and accessibility are key barriers to consuming a nutritious diet. The reality is that healthy foods are not readily available in many communities around the world. And when they are, their cost is prohibitive. Young people are calling for a whole community effort to address these dietary challenges that confront them. As you can see on the slide, adolescents within these workshops identified 4 priority areas where policy action would make a meaningful difference to their ability to make healthy eating choices. To achieve this, all levels of community must come together to ensure adolescents can thrive.
Thank you, Catherine. Fantastic. Thanks for sharing those insights. I think adolescence is a critical time in which children develop healthy eating habits that can sometimes carry through for the rest of life. The other end of the spectrum, another critical moment in children's lives is indeed those early years in the first 2,000 days. And to tell us a little bit about that end of the spectrum, I would like to introduce now Professor Virginia Schmid from the School of Nursing and Midwifery at Western Sydney University. Professor Schmid's an international figure in the fields of midwifery and maternal and child health. She collaborates with research leaders at WSU and beyond to build capacity in maternal and child health research on breastfeeding, young child feeding, and the social and emotional health and well-being of new parents, particularly those in disadvantaged communities. Welcome, Professor Schmid.
Thank you. Thanks, Amanda, and thank you for the opportunity to share the findings of this important work. I was really privileged to have the opportunity to lead the analysis and the reporting of the mothers' experiences of nutrition around the world. 573 mothers participated, and 40 mothers who were immigrant women living in Sydney were part of this group, and they took part in 39 workshops in 18 countries to talk about how they fed their children and the challenges that they face in providing high quality nutrition. Now, in line with international recommendations, mothers believed that breast is best. They noted that breastfeeding has long-term benefits for their baby and protects their baby from infections, reduces the risk of adult disease, and also that it's economical. Yet while 90% of mothers in this study commenced breastfeeding at birth, by 6 months of age, 1 in 2 babies were receiving or being fed breast milk substitutes. This, together with 25% of babies who were fed other liquids such as tea and water, often with sugar added, immediately from birth or introduced in the first week after birth, will be impacting on the nutritional status of the children. Many children then were introduced to complementary or their first foods, solid foods, prior to 6 months of age. And for a small number of these, this was actually before 4 months of age. So the high proportion of children who are receiving breast milk substitutes and the prelacteal fluids before from birth and in the first weeks is worrying. And it's particularly so because many of these children were from countries where they bear the burden of stunting and wasting. Mothers reported that young children's dietary intake was poor. And we've heard this highlighted both from Tony Stewart and E.D. Ford, that on an average day, the majority of children aged 6 to 23 months did not consume a serving of fruit, vegetables, animal or plant proteins. And worryingly, only 16% of children in this age group across the globe consumed the recommended 5 or more food groups daily. So globally, children's consumption of processed and ultra-processed food is increasing in countries of all income levels, negatively impacting their health and development. And even though in Australia and in Serbia were 2 countries where children did have 5 food groups a day, they also were the groups that consumed, or the children that consumed, the more processed and ultra-processed foods than in other countries. Now, we also found that mothers' diets were not reaching the recommended guidelines. So on an average day, 3 out of 5 or 60% of mothers in the study consumed a serving of grains and vegetables. And only 1 in 2, 50% consumed animal protein, and less than 50% consumed a serving of fruit. Importantly, mothers' diets did improve a little bit during pregnancy, and this is critical because the nutrition that a baby receives during fetal development, during pregnancy, is really critical to their nutritional status going forward as they grow. Now, mothers identified many obstacles to healthy eating. So this is a key interest of the project. Why is it that so many mothers are challenged in being able to feed their children as they would like to feed them. Financial constraints were reported by 80% of mothers. This was to be expected, we think, of course, from low-income countries, but also mentioned by mothers who were living in high and middle-income countries. So one mother from Guatemala said, if I had the money, I would purchase the healthy food that I would like as a good mother to give to my children, or as a mother, the mother I want to be. 1 in 3 mothers experienced food shortages, so there was limited availability of food, of quality food, and little of variety. And mothers also, 1 in 4 mothers also talked about just not having the time to actually be able to access healthy meals or prepare healthy meals for themselves and their children because of the pressures of work, both outside and within homes. And many mothers lack the support to assist them with food preparation. When time poor, mothers prioritise feeding their child rather than themselves. Mothers also reported other obstacles. So, for example, many 40% so 2 out of 5 had the perception that their children were fussy eaters or uncooperative eaters. And one immigrant mother in Australia said, my child will not eat any healthy food, he just refuses it. And we heard stories of children, not sitting still during meal times, having to be followed around or chased to get spoonfuls of food into them. A few mothers alternatively described responsive feeding practices where they were more guided by the cues of their child. And here one Australian mother said, if there are foods that she routinely leaves and does not want to eat, I will continue to introduce those foods regularly. And after a time, I find that she actually does start to eat them. Family members, particularly the mother's own mother, were influential in decisions mothers made about feeding their infants and young children, but not as much as we'd expected. So many mothers said that they were actually the ones who made their own decision about feeding their child. Mothers did turn to trusted sources such as family members who they found supportive, but we also heard the stories that we often hear. And one mother in Australia said, my mother-in-law told me that my milk was not good enough and that I needed to give formula. And this was because her baby was unsettled. Mothers also reported that health workers were the go-to people for sources of information, and we were surprised at the few numbers of mothers who said that they used internet and used government sources of information. So in summary, the insights of the mothers of this report provide some striking evidence of the challenges that many families face in feeding their children around the world. Community, governments and businesses need to come together to provide support and guidance to initiate and establish breastfeeding with information to access to practical information for mothers about managing breastfeeding difficulties. They also need to strengthen the knowledge and skills of health professionals so that they can deliver information to parents in a way that they find is helpful and meets their needs. They need to invest in social protection systems that reduce the financial barriers to healthy food and nutrition. And mothers call for tighter regulation of commercial marketing practices. And it's really important, mothers said, to further engage family members and community networks to help them to realise children and mothers' nutritional needs. As one immigrant mother from Australia who had come she come from India, and she said that it was so important that what we need is a community to help our children learn to eat. Thank you.
Thank you, Virginia, for sharing those insights. Just a reminder that if you do have any burning questions that you'd like to ask of any of our panelists today, you can enter those at the Q&A button down on the bottom right of your screen. Now, having heard a little bit about the key findings from each of these two reports, I'm now very pleased to invite Ms. Florence Siborama, who's a Sun CSN youth leader for nutrition from Rwanda, to respond to these reports. Sun CSN is the Scaling Up Nutrition Civil Society network, which aims to empower young people, primarily those from countries with high rates of malnutrition, with the skills they need to advocate for an end to malnutrition in their own communities and globally. Florence is a medical doctor and in 2020 has been on the front line of Rwanda's COVID-19 response. She also founded the Youth Powered Nutrition Advocacy Project in Rwanda. Florence, welcome.
Thank you so much. I'm Florence Siborama, as she said. I'm a young medical doctor in Sun Civil Society Network, in leader for nutrition from Rwanda. I'm really delighted to be part of this panel tonight, representing young people to talk about our experience and our lot to deliver to health nutrition for all. Personally, I have grown up in a community where 2 in 5 children are stunted. And we all know that stunting is a reversible form of malnutrition, which affects children's brain development and thereafter affects their future career and productivity. This burden of malnutrition in Rwanda is mainly due to poverty, inadequate knowledge of mothers on health and nutrition, big number of children per family, culture, and other reasons similar to other countries across the world, as stated in the report developed by UNICEF in partnership of Western Sydney University. Rwanda has made impressive progress to fight malnutrition through different community development programs like One Cow per Family, distribution of nutritious supplements to poor families, community screening of malnutrition, community education on hygiene, nutrition, and family planning by community health workers, and encouraging families to have one kitchen garden per family so that they can grow some vegetables by themselves. Despite all efforts, adolescent nutrition has been left behind in the nutrition agenda like other parts of the world. Adolescents, a group that has been previously absent from the global health agenda, are now being recognized as providing an important opportunity to break the intergenerational cycle of growth failure. The most recent global estimates are that 16% of the world's population are adolescents, 19% of whom live in low and middle income countries. Half live in Asia, but only in Africa are adolescents the largest portion of the population with 23%. With this large portion of young people and increasing trend of teen pregnancies, especially in low and middle income countries, adolescent nutrition is an important element to include in global nutrition agenda. Although I was in medical school learning about the importance of nutrition, but I rarely minded about what I eat because I wasn't trained that in my culture. I used to go for unhealthy food because I found them delicious and I felt peer pressure to do so. So based on my personal experience of weak consideration of health habits before I joined this Leader for Nutrition program and the big number of patients consulting the clinic complaining disease related to poor nutrition, I was so inspired to create the Youth Powered Nutrition Project in Rwanda as part of my campaign, aiming at strengthening the capacity and engagement of young people in nutrition advocacy to increase their knowledge on nutrition and improve the behavior towards the health lifestyle. In this project, I have established a network of 30 young people from 30 districts of Rwanda with high representation of young girls as future mothers to ensure health and nutrition in their families so that we can work together to increase community knowledge on nutrition and advance nutrition advocacy. So far, we have done community campaigns that help the population in increasing their knowledge on nutrition, but as a behavior change is a journey, this shouldn't be one-time activity. Rwandan District Youth Champions have implemented different community campaigns, including kitchen garden per each family, so the families can grow vegetables by themselves. Also, poultry has been provided to the families with less disposable income, so they are able to feed their children with animal protein from eggs. Youth clubs for health and nutrition has been established to discuss life skills around nutrition and sexual reproductive health life. Yeah, so this project is responding to some of the challenges identified in different countries, stated in the two reports developed by UNICEF and Western Sydney University, but there are more needs to be done. As I come to my conclusion, I'm calling all relevant and concerned stakeholders to include the voice of young people and support the initiatives in nutrition advocacy. To include nutrition knowledge of young people through the attractive and interactive education model. To empower women on nutrition as the key people to decide food choices to their families. To integrate nutritional care as a part of the package we healthcare providers deliver to the patient. To support the young people and women in agribusiness so that we can attain food security. To improve multi-sectoral collaboration. To establish a continuum for good nutrition of adolescent girls and boys. Thank you so much.
Florence, thank you. And congratulations on your very fine work there in Rwanda. And yes, and I think, you know, it's lovely to hear that firsthand experience. There's a real sense from the reports that we've done that actually exactly the kind of whole of community action that you've just described is really, really critical. Thank you. Thank you. And please stay on the screen. We're going to now turn to Q&A, and I'm going to invite all our previous speakers to turn their screens back on. And allow me to introduce a couple of additional panel members, esteemed panel members indeed. Firstly, please say hello to Ms. Peggy Konis-Buher, who is the Senior Technical Advisor on the USAID Advancing Nutrition Global Technical Assistance Project and serves as nutrition lead at the JSI Research and Training Institute in Washington, DC. Peggy supported the development of nutrition and social and behaviour change programming in more than 40 countries with a focus on infant and young child feeding, adolescent nutrition and early childhood development. Also joining us is Professor Rafael Perez Escamilla, who's a tenured professor at the Yale School of Public Health. His work has led to improvements in maternal, infant and young child feeding and early childhood development programs globally. He's published over 270 peer-reviewed articles and lectured extensively across world regions. He's an elected member of the US National Academy of Medicine and has served as a senior scientific advisor to UNICEF, the World Health Organization, and FAO. Also joining us is Deepika Sharma, who leads UNICEF's global portfolio on nutrition for school-aged children and adolescents at UNICEF headquarters in New York. Deepika has extensive experience of working on grassroots and systems strengthening nutrition policy and advocacy. Deepika is from India and started with UNICEF some 11 years ago and says that she's been continuously inspired by UNICEF's mandate to protect children and to support them to reach their full potential. Our team at Western Sydney is very grateful to Peggy, Raphael and Deepika, among others, who were all expert advisors on the consultation and analysis underpinning these two reports. And lastly, but by no means least, we're joined by Ruth Situma, who leads UNICEF's nutrition portfolio in Ghana. Ruth has over 15 years experience in managing large-scale food and nutrition security programs in different countries and at UNICEF headquarters. Ruth holds a master's degree in public health nutrition from the London School of Hygiene and Tropical Medicine, and she's a passionate advocate for multi-sectoral actions and accountability to address all forms of malnutrition among children, adolescents and women. Welcome panelists, how are we all this morning?
Great.
Thank you so much for joining us. Peggy, I'm going to start with you actually. I'm wondering if you can tell us from your perspective, what are the key issues for adolescent diet and nutrition, and perhaps what's the value of the methods and the findings of the studies that we're launching today?
Well, thanks, Amanda. But first of all, I want to congratulate the entire team at Western Sydney University and UNICEF headquarters and the 18 country offices that participated in this amazing work. I am thrilled and humbled to have been a very small part of this effort. So just amazing. And in terms of the key issues, we know that the diets and nutritional status of the world's estimated 1.2 billion adolescents has a profound impact, not only on their current and future health and well-being, but also that of their future children and society as a whole. Adolescents around the world are seriously confronted by inadequate access to healthy foods, a lack of meaningful exposure to food literacy, and to healthy food environments, and they suffer tremendous micronutrient deficiencies. And during this key period of development, the absence of adequate nutrition contributes to impaired cognitive function, nutritional deficiencies and malnutrition, and inhibits an adolescent's ability to thrive and participate in social, cultural, and economic life in their countries. By promoting healthy diets and eating practices during adolescence, we know that we can have the potential of mitigating nutritional deficiencies generated during the first decade of life, or the so-called second window of opportunity. We can reduce the high rates of iron deficiency anemia, especially among adolescent girls, and we can break the intergenerational cycle of malnutrition and limit the epidemic of obesity and non-communicable diseases in adulthood. But we need to engage adolescents in helping us understand how they think about food, what their priority nutrition issues are, and how and when they can best access information about food and nutrition. In terms of the value of the methodological innovations used in the study, I don't think I can say enough about the innovative, creative, and participatory activities that the research team employed. I think the team gave true voice to the adolescents who participated in these small groups. The techniques created space where the adolescents felt safe in sharing their experiences and their many creative ideas about how best to solve some of the complex problems confronting them from their own experience and their own perspective. I also wanted to underscore that this research addresses some work that was supported by USAID, UNICEF, WHO, and others back in 2018, an adolescent call to action, where 7 priority actions were articulated. This call to action was signed by over 120 organizations worldwide. And this research, I think, really helps the focus on the importance of engaging and participating with adolescents in this process of designing and implementing research. It's a really unique experience, and I'm very excited about the work you've done. So with that, I'll turn it over.
Thank you, Peggy. Thank you. Yeah, and it's been a great experience to hear what adolescents all around the world have had to say. And I think, you know, as with any piece of research, the challenge is making sure that those voices are activated in policy and programming settings. So I wonder, Rafa, if I can turn to you and just ask you how you see that working for the insights of mothers in these reports. What's the value of consulting with mothers on their diet and nutrition for both global and country level policy and programming? What do we need to do to activate their voices?
Absolutely, Amanda. And as someone that has been a maternal and child health and nutrition researcher for over 3 decades now, I could not think of a more important task and challenging task than trying to represent the voices of women in relationship to the challenges they face with the nutrition and well-being of themselves and their crucial. This is absolutely necessary for designing equitable maternal child health and nutrition programs globally. This report not only represents the voices of women with dignity, but its degree of inclusiveness is remarkable, as it included more than 500 mothers across 18 countries, attending workshops specifically to talk about the challenges they face in receiving and providing high quality nutrition. The key issue that comes up first is the fact that a lot of women work and do not have the time and support needed to prepare healthy foods for their children and themselves. A horrendous choice, which is simply unacceptable as far as I am concerned in the 21st century. A second huge concern is that almost half of the mothers reported introducing infant formulas or other types of breast milk substitutes. Of those who had introduced breast milk substitutes, 20% did so at birth, which is a major risk factor for failure to establish lactation. Unfortunately, this study, through the voices of hundreds of women, confirms that the World Health Organization code violations appear to be rampant across countries. As indicated in the report, currently the promotion of healthy foods and practices by government agencies and health and nutrition services is overshadowed by the marketing practices of the infant formula industry and manufacturers of ultra-processed commercial foods. And those unethical practices must stop now. A third concern is how pervasive food insecurity is. As a mom from rural Ghana stated, there is not enough money in our house to buy different foods for my child. And even if I did have the money, the food is not available. This leads me to my fourth and last concern that I will address today, which is the enormous need to address the dominance of ultra-processed foods and sugar-sweetened beverages in the food systems surrounding young children and their families. There is no doubt in my mind that the so-called first food systems should be included as part of the current call for revamping food systems globally. And under this new vision of the first food systems, of course, breastfeeding and appropriate complementary feeding must be included as one of its pillars. Many thanks to all of you, and especially to UNICEF and Western Sydney University for allowing mothers from across the globe, probably for many of them for the first time, to express their voices on one of their most fundamental human rights, which is how to attain food security for themselves, their children, and their families. Thank you so very much indeed.
Thank you, Rafa. Thank you. Yes, and it's a great honour when people come together to share experiences in this kind of way, especially those women who might not otherwise have had a choice. So it's fantastic that UNICEF is able to support those women to participate. Yeah, great. And look, Ruth, I'm going to turn to you next and just ask you to tell us a little bit more about the main challenges that young mothers and their families are facing in Ghana in terms of accessing healthy diets, and what work is being undertaken by UNICEF to improve those diets and diet and nutrition services.
Thank you very much, Amanda, for the opportunity, and it's very exciting to listen to the outcomes of the report and just to hear how unifying the challenges are across the world when it comes to mothers and how they care for their children and how they feed their children and the struggles that they go through. So for Ghana, while we've made substantial progress in reducing undernutrition over the last decade, today, we still have at least 1 in 5 children who are stunted, and 24% of all child deaths in Ghana are associated with undernutrition. And the main reasons for this is because too few children are being fed and cared for well enough for them to survive and thrive. For example, only half of the children are put to breast within the first hour of life. Exclusive breastfeeding rates are reducing from 60 about 5 years ago, and now we've gone down to 43%. Only 1 in 10 children receive a minimum diet for them to grow and develop well. So for us in Ghana, we wanted to understand more what are the challenges that the mothers and families are facing in Ghana in feeding their children. We undertook several studies to do this. One was the social norm studies. We wanted to look at the social norms and the practices. We also looked at the parental study to see how parents care for their children and what are the challenges that they undergo. We also looked at, undertook what we call the landscape analysis on infant and young child feeding practices, which also helped us to identify the key issues. And from these studies, the challenges that mothers and families are facing in feeding their children are very clear and actually very similar to what you've shared across this evening. And for us, we can summarize at least 3 of them. 1, with rapid urbanization in Ghana, more mothers are working either in formal or informal sectors, and therefore mothers and families do not have time to feed their children and do not have the support. And to compound this in Ghana, majority of the businesses and the employers have no policies that support mothers to care and feed for their children. So it's a big gap. The second issue are cultural beliefs and practices. While mothers and families may have the knowledge on how to feed their children well, cultural beliefs remain quite strong and influence what mothers and families feed their children. For example, in Ghana, there are food taboos around prohibiting mothers to be able to give their children protein from animal source. We have about 20% of our children less than 6 months being given water or other traditional concoction because of beliefs and practices. And then the other issue, the third issue that is a big problem for us is around food affordability and access. And I think Raphael put it very well, because that still is a big problem for us. And now with COVID-19, it's even worse. We are doing at the moment assessment of the impact of COVID-19 on food and nutrition. And increasingly, we are seeing less and less households accessing fresh foods and vegetables or nutritious foods because they do not have the funding to buy. So what are we doing about this? So from August this year, UNICEF has been working with the government of Ghana to implement a year-long campaign. The campaign is dubbed Start Right, Feed Right, from birth to 2 years. And the campaign was launched by Our Excellency, the First Lady of the Republic of Ghana. And the main idea of the campaign is to support mothers and families on how to start right and feed their children right. And that means we need to have the whole community of Ghana supporting mothers and families to feed their children. And it's not only a business of the mothers and families, but a business of everybody. We have several work streams at policy level, institutional level, community. But just to give a few examples of the actions we are undertaking with the government, one is scaling up social behavior change and communication to address some of the cultural beliefs, and working with the traditional leaders, because I think for Ghana, the traditional leaders are quite strong in terms of influencing. And we feel, for example, the low-hanging fruit is around making sure that the children are given only breast milk and not water and the concoctions that are given in the first 6 months of life. And we feel with this, we can actually increase our coverage of exclusive breastfeeding by 20%, because 20% of our children are given water. The other thing is addressing the issue of giving children animal protein. So again, encouraging families to be able to give what we are saying the 4-star diet, That's what we are promoting currently. We are very lucky also at this time. We are working with the other partners to be able to develop our food-based dietary guidelines. And now with these kind of findings, it's really helping us in terms of guiding where do we need to provide the relevant recommendations when it comes to our national food dietary guidelines. And at the moment, we've prioritized early childhood nutrition as a key area that we need to really solidify our recommendations, as well as adolescent nutrition and maternal nutrition. And then the other area that we are working with the government is to address the issue of affordability. We are very lucky that the government of Ghana has social protection schemes. One is what we call the LEAP, the Livelihood Empowerment Against Poverty. And then we also have the National Insurance Scheme. So for both these two social protection schemes that we have in place, we're ensuring that we are linking with the nutrition component. So the children, the households with poor households, but also have issues with affordability of food, are the ones who are going to be given the resources. And we've started this and continuing now even with the COVID-19. The other area is because of increasing urbanization and businesses and employment, both formal and informal, which we encourage, and the government is happy with that. But then at the same time, it's now engaging the businesses so that they have friendly workplaces that are supportive to mothers and families to be able to care and feed for their children and have that flexibility as they support their children. And then, of course, also going ahead, and we're working with the First Lady to intensify advocacy around supporting mothers, working mothers in urban areas, and especially in informal urban setting. So those are some of the things that we're doing at the moment in terms of addressing some of the gaps that we have in place.
Yeah, Ruth, thank you so much for sharing that. And again, I'm struck by the way that, you're tackling these issues from multiple different angles and trying to think holistically about the solutions. And indeed, there's a question in Q&A that I might come back to you on if we have some time around maternity leave for women and the impact of work environments on mothers feeding their children. Before that, I'm going to turn to Deepika. Deepika, what are the main challenges that adolescent girls are facing in India with respect to their own nutrition and diets, and what sorts of actions would improve their diets?
First of all, can you hear me clearly? Can you hear me clearly, Amanda?
Yes, we can, Deepika. Thank you.
Okay, great. So first of all, before even I attempt to answer that question, I would like to congratulate you, Professor Schmidt and Catherine, and the entire team of researchers who worked at the field level and the country offices who worked with you to come up with such gems. Both the reports are so enriching and so full of good information that we can use for our programming and inform policy and programs. Now you asked me a question on India. So before, I would like to just put things in perspective. So India is home to 1/5 of the world's adolescent population, 253 million out of the population of 1.2 billion adolescents. And obviously, the global community cannot achieve the SDG agenda if India's adolescents are not nourished and growing well. We have some latest statistics from India, which is quite alarming, and this is from a comprehensive national nutrition survey, which was led by Ministry of Health and supported by UNICEF and other partners. The survey shows that almost all adolescents in India consume unhealthy or poor diets, which results in either one or the other form of malnutrition. And adolescent girls suffer from multiple nutritional deprivations, especially in the growing years. Girls are shorter and anemic, and they have short stature. And one in 3 girls have anemia. The situation worsens as they grow in age due to the demands of the body. And this has not only physical implications, but as we all know that this has implications on adolescents' ability to lead a productive life, their cognition, their achievement in school, the continuity of their education, and it presents a huge challenge. Another big challenge is the increasing consumption of unhealthy foods, which are high in fats, trans fat, sugar, and salt, and absolutely no or very poor consumption of fresh fruits and vegetables. And this is all information that is coming from a very robust survey that was conducted for children 0 to 19 years of age. In addition to diet, we all know that physical activity helps in maintaining healthy weight and active lifestyle. Well, from the data, we have observed that all girls and boys are unable to meet the WHO recommendation of 60 minutes of outdoor sports or activity per day, which is alarming. And on an average, the girls and late adolescents spend only 10 minutes of their time per day on such activities. So you can imagine the implications on their life, mobility, and growth. And further in India, the situation is compounded by gender roles, lack of autonomy, and decision making. It actually exacerbates the situation. Girls have little say in their own life or life choices on what to buy, when to marry, whom to marry. Gender norms, preference for son impacts food distribution within families. Safety issues impact access to schools and continuation of education for girls as they reach puberty. And social issues such as marriage and pregnancy also affects their growth and development. If I can say that, then from my own experience of growing as a teenager in India and also having the opportunity to work in India, I would like to say that investment in nutrition and well-being, providing education opportunities, continuation of education, and imparting 21st century life skills to build leadership, agency among adolescent girls should be a national priority. It should be a collective responsibility. And it is important that good nutrition becomes the foundation of such a priority. In India, the government has been very proactive in addressing the situation of malnutrition and prevention of and developing actions to prevent malnutrition. For instance, there is a program which is it's a nationwide program to address anemia, to prevent anemia among adolescent girls, and it is called Anemia Free India or Anemia Mukt Bharat. But the data shows that the coverage needs to improve further for such nationwide programs, and especially in the vulnerable parts of the country. Further, I think there's enough evidence for that too. A common narrative and concerted policy action starting early on in the school age years are important to prevent overweight and obesity among adolescents, which is gradually increasing and also presents a high risk for NCDs. The country needs strong policies to restrict sale of unhealthy foods and within and in the vicinity of the schools. These critical actions that I've shared obviously cannot be the sole responsibility of one sector or one ministry. It is imperative that there is a shared vision which invokes accountability across the ministries and their work around social determinants. So every ministry needs to contribute, every system needs to contribute: health, education, social protection, water and sanitation, agriculture, trade, finance, and many more. So if we really want to move the needle to improve the nutrition of adolescent girls in India, everybody has to come together and every ministry has to contribute and all the partners have to make it on their agenda. Thank you. Thank you for giving me this opportunity.
Yes, thanks, Deepika. Thank you so much for sharing that. And I want to pick up on some of the gender issues you've just talked about. And in fact, I want to open this out to the panel broadly, and anybody with a tweet length response, because we are running short on time, it could give us some suggestions about how to answer this question. But obviously, we've talked about how there are a lot of challenges for women and for young girls vis-a-vis their diet and nutrition. But a question from the audience is, what role can men and boys play in improving nutrition for adolescents and for mothers feeding their children? Who would like to have a go at that one? Shall I throw to you, Peggy?
I think they have an incredibly important role, and we have a lot to learn still. We've got to figure out how to engage young men and adolescent boys in nutrition and in their awareness and their understanding of the impact on their own lives and that of
We've got a lot of work to do.
We have a lot of work to do.
Yes, and I can see how that would be the case. Rafa, can I ask you, what could men do to support women breastfeeding?
So very quickly, support, and more support. And really understanding also that breastfeeding and other aspects of infant feeding are part of nurturing care, and that they have a big role to play, not only with breastfeeding, but in general with the provision of nurturing care to their partners and also to all the kids in the family. So I also think that it is very important moving forward for UNICEF projects, for any public health projects that try to improve maternal and child health, to have a focus on the whole family, not only on the child, not only on the mother, because we have been leaving out those fathers, those husbands, those partners, and we know that for good or for bad, they have an enormous influence on what happens with the health and nutrition in the households. And I think they probably would welcome a lot the opportunity to show, or we welcome the opportunity to show that, yes, we can very much be a very supportive part for the nurturing care framework.
Thanks, Rafa. And Ruth and Deepika, do you have comments to make on that question?
Thank you, Amanda. Just to agree with Raphael in terms of support. And in fact, when you asked the question for Ghana, I felt like they have everything to do with making the difference, because when I look at the decision-making mechanism here in Ghana, if the men are not engaged, will not make any headway, whether it's at policy level or even at household level. And just to give an example, like when we have also a program called the GIFTS program, which we provide iron folic supplementation to young girls. And we are now using schoolboys also to do the awareness and create awareness that it's okay for the girls to get iron folic tablets and to encourage them, even if the boys are not getting the iron folic tablets. So I think for me, they're the game changers, at least in the environment in Ghana at the moment, in terms of decision making at every level. So men have to be at the center.
Well, I'm glad to hear that you've got 3 boys, because that's a great platform for change, Ruth. And over to you, Deepika. Do you have a comment on that one?
Yeah, definitely. And this is really close to my heart, because in our programs, we are trying to involve the boys as much as possible. So programs need to be holistic, and it's adolescent girls and boys. And that is our commitment. And so very important is that boys can be agents of change. They can work with us, and we need good evidence. I'm glad that this report also involved boys. These reports are collective voices, which is so nice. Then For example, if I talk about school age years and adolescents, in your report, also in this report, as well as from the evidence, we have seen that adolescents have expressed that they want to know more on nutrition. So nutrition education is still weak. They want to be empowered. They want to learn more. So when we talk about nutrition education, we need to involve the boys too in that. It's not only when we're going to talk to the girls. It's when we talk about curriculum, it has to be boys together. When we talk about physical activity, it has to be girls and boys together. And Ruth was giving an example of Ghana, and I was in the field, and then the distribution of iron, folic acid supplementation was going on. So boys said, "Oh, why don't you involve us in supporting them?" So this came from the field, which was really very, very, it really made me very happy. And they said that teach us, support us so that we can support them. So, boys can always be involved, and they need to be involved, and it should not be tokenistic. It has to be meaningful, and they have to be involved just like girls, and target, and the program should be targeting boys too, especially the nutrition education, awareness, generation and impartment programs. Thank you.
That's fantastic, Deepika. Thank you for that really thoughtful response. I'm going to ask Nukta, please, to share the links in the chat of the webinar here, so that people can access the reports. And I'd like to now turn to well, thank you to all of our panelists. I'd like to now turn to Dr. Victor Aguayo, who is the Associate Director of Nutrition at the UNICEF Program Division. His career is guided by the conviction that hunger and malnutrition are a violation of children's rights. And Victor has over 25 years of policy, program, research, management, and humanitarian experience in maternal and child nutrition in Latin America, Africa, Asia, and he's currently at UNICEF's New York headquarters. Victor has previously served as Chief of UNICEF Nutrition Program in India, as Regional Nutrition Advisor for South Asia, and Regional Nutrition Advisor for Western Central Africa. And Victor, over to you for some closing reflections, please. Thank you.
Thank you, Amanda. Let me first check that you can hear me well.
Yes, we can. Thank you.
Thank you so much. I also realized that we are running a little bit late, so I want to be brief. So thank you, Amanda, and greetings for UNICEF, for our colleagues and friends around the world. And I know that we have many of those today. This year is an important year for UNICEF. In 2 weeks, we are going to be launching UNICEF Nutrition Strategy for the next decade, for the next 10 years. The goal of our strategy is to support good nutrition for all children, but also for adolescents and women everywhere. And our strategy is guided by the Convention of the Rights of the Child that acknowledges the right of every single child to food and nutrition as a human right. So our strategy and the 2 reports that we are launching today, Amanda, highlight that we should not give the responsibility of feeding children uniquely to mothers. The fact is that limitations in cash, we heard about it today, limitations in knowledge, limitations in time, shape the ability of mothers to secure good nutrition for themselves and for their children. Therefore, as it was mentioned by Rafael, the entire family, community, and the nation needs to be engaged to share the responsibility of feeding young children and adolescents. There is little doubt in my mind that food systems are failing children because they are failing to provide children and adolescents with the nutritious, safe, affordable, and sustainable diets they need. And ED4 mentioned this at the very beginning. When babies in Nepal, for example, get a quarter of the calories they eat from junk food, we know that we have no time to waste. Diets that are heavy in these unhealthy foods are not only driving overweight and obesity, but also stunting and micronutrient deficiencies. Therefore, we need to create food environments that actually secure nutritious and affordable diets for children at home, in schools, and in markets. And we need to get very serious about stopping marketing of unhealthy foods to children. I want to be very clear. Such marketing exploits children's vulnerabilities, violates children's rights, is pervasive, and needs to stop now. I also feel, as was said before, we need to acknowledge that millions of families around the world simply cannot afford healthy diets for their children. This is happening in low-income countries. It also happens in middle-income countries. It is happening in high-income countries. And the COVID-19 pandemic is not going to make the situation easier. Therefore, national governments need to step up their games. They need to step up their social protection programs to make sure that all children, adolescents, and women have access to nutritious, safe, and affordable foods. But we, the international community, also need to step up our game. We need to step forward together and deny the COVID-19 pandemic a legacy of hunger and malnutrition in children. So on those words, I do want to congratulate for groups of people. First, the teams of Western Sydney University and UNICEF, globally and in countries, for leading these two reports. This is a huge contribution to our thinking, to our advocacy, and to our ability to shape national policies and programs. I want to thank our advisory group, including Peggy and Rafael, who are today with us, for their time and contributions and their intellectual generosity. I want to express my gratitude towards the governments of the Netherlands and Norway for supporting us financially and morally, because they are with us not only financially. And above all, I want to express my gratitude to the mothers, the young children, and the adolescents across 18 countries, without whom this work would not have been possible. So thanks to everyone. And this is an important day to all of us. And I want to thank all of those who made it possible. Thank you so much.
Thank you, Victor, for a really excellent summary, and also for thanking all of the people that need to be thanked. Of course, if it takes a village to raise a child, it took a city to make this study happen. In addition to Victor's thanks, I just want to thank the team behind the scenes who made the launch possible today. Thank you so much for all your work and effort. But lastly, thank you to everyone who's joined us for this webinar. You can find links to the reports on your screen now and in the webinar chat. And it's our hope that they provide useful content for guiding the ongoing discussions and urgent action relating to child and maternal diet and nutrition around the world. We encourage you to download the reports, and not just to read them, but to activate them in your policy and programming work. Thanks again for joining us, and goodbye for now.